Okay, hello guys. So, whenever a patient in early pregnancy, 8 weeks, 7 weeks, even 4 weeks, comes to us with PV spotting or low abdominal pain, or she is having, tachycardia, low blood pressure, getting vitally borderline unstable, we basically confirm an intrauterine and rule out an extrauterine pregnancy. So, this patient who came to us, let me just talk about her, okay? I'm not gonna disclose her identity. So she was gravida 3. She was gravida 3, para 2, and she was 9 weeks according to her LMP, and she had two earlier scans, okay, which showed an intrauterine sac, but there was no picture attached with the scan. So those scans were done from, from random private setups, okay, and presumably you would think that it's an intrauterine pregnancy because of the reported scans, but there was no picture. So now you know the importance of picture, how important it is to have at least one picture of your early pregnancy scan. She had no pictures. Now this she brought today. That day, so what was there? You can see this is the right adenexa, and here you can see that there's a proper fetal part, and this is the uterus, and this is the CT. In this picture, you can also see the same finding. This is the CT. You can see the CT is intact, which means that in this scan there is no intrauterine pregnancy. It is an ectopic, and this scan was done right on that date. It's a story from 2 days ago, okay? And so this was an ectopic pregnancy throughout, and nobody knew. And so it's very important to get a proper scan from a good place in your early pregnancy for the confirmation of pregnancy. Look at this. Okay, so you can see the CET is intact, and there you can see the proper mass in the right adnexa, and it was a proper ectopic with a fetal pole, and there was no FCA. So an urgent laparotomy was done because it was, ruptured and then organized. This portion was communicating with the outside, so it was partially ruptured, and she could have, collapsed anytime. So with this story, the importance of having, so always ask for a picture when you're paying for a scan. I would always ask for a picture.